Hello everyone, welcome to our YouTube channel Logic Medico. Today's interesting topic is inferior oblique. If you are new to our channel, kindly consider subscribing to our channel. Don't forget to press the thumb button because you may forget in the end to press that button. Kindly share this video with your family and friends. Now let's start the topic inferior oblique. This inferior oblique is one of the muscle of the eyeball. It is outside the eyeball, so we call it as extraocular muscle. This muscle will be dealt under the following heading called as location, origin, insertion, nerve supply and actions. So the origin of this muscle is from the floor of the orbit. Okay, you can see here the floor of the orbit. It will take origin. Muscle goes backwards and laterally, then hooks around the eyeball. This is the eyeball. So optic nerve, eyeball will divide into two halves by the equator. This is hooking around that to get attached to the posterior lateral part of the sclera of the eyeball. Okay, so we can see the same thing over here in a better view. This is the maxilla. The origin of this muscle inferior oblique is from the orbital surface of the maxilla, close to the anterior part of the orbit. Then it goes laterally, upwards and backwards, and hooks across the eyeball to get attached to the posterior part of the sclera of the eyeball. That is an insertion. Here superior oblique is shown so that you can understand that the superior oblique is hooking from above. You can see the inferior oblique is hooking from below. The term oblique is used because the eyeball, you can see the eyeball orientation. So if it is straight like this, we can call vertical. If it is like this, you can call horizontal or transverse. If it is neither vertical nor horizontal, what will you call is the word oblique. So there are two obliques around the eyeball, one from above, so we call it as superior oblique muscle, one from below, we call it as inferior oblique muscle. Both of them are attached to the sclera of the eyeball, posterior to the equator. Equator of the eyeball is a plane which divides the eyeball into two halves, anterior half, posterior half. These two obliques are attached to the posterior half. To be more precise, in the posterior lateral quadrant of the eyeball. That is the insertion. So origin and insertion of this muscle is over. Now nerve supply. There is one statement, kindly remember, all the extraocular muscles are supplied by third cranial nerve, that is oculomotor nerve, except SO4 LR6. SO means superior oblique, 4 means fourth cranial nerve or trochlear nerve, because superior oblique will pass through a pulley called trochlea. Okay, you can see one video of mine based on the superior oblique and trochlear nerve. Then LR means lateral rectus, supplied by sixth cranial nerve, abducent nerve. You can see one more of the video of lateral rectus for a better understanding. So all the extraocular muscles are supplied by third cranial nerve. In fact, even the inferior oblique is supplied by third cranial nerve. So third cranial nerve or the oculomotor nerve splits up into two divisions. Upper division supplies the muscle above the eyeball. Lower division supplies the muscle below the eyeball. So inferior oblique is lower or above? Of course it is lower. So the lower division of the oculomotor nerve supplies inferior oblique. So the last subdivision is actions of the muscle inferior oblique. So inferior oblique muscle, okay, it is coming from the floor of the orbit, okay. Then it goes onto the posterior lateral side of the equator. Here superior oblique is shown for you so that you can understand inferior oblique orientation. This is superior oblique hooking through the trochlea, going to the posterior lateral quadrant of the eyeball. Okay. So if the superior oblique contracts, this eyeball goes downwards, forwards and medially to see the tip of the nose, and that action is called as intorsion. Whereas inferior oblique starts from the floor of the orbit, okay, floor of the orbit, it goes and gets attached to the same place where the superior oblique is attached to the sclera of the eyeball behind the equator. So if this muscle pulls the eyeball will go in this direction, upwards, backwards and laterally. It will go like this, upwards, backwards and laterally. This action of the eyeball is called as extorsion. If the eyeball goes downwards, forwards and medially, it's called as intorsion to see the tip of the nose. That action is action of superior oblique. Okay, for better understanding, I'm telling you the action of superior oblique also. Whereas this muscle, inferior oblique, is acting from, it's beginning from here but it's actually acting from this corner, so it pulls the eyeball towards that corner, that is upper and lateral corner, upwards, backwards and laterally. And this action of the eyeball is called as, this movement of the eyeball is called as extortion. The upwards, backward and sideward movement of the eyeball is called as extortion of the eyeball. So that is the action of inferior oblique. Additionally, it helps superior rectus in causing elevation of the eyeball. It also helps lateral rectus in causing abduction of eyeball. Sir, why elevation and abduction? Okay. See here, this muscle is, though it begins from here, it takes origin from here. I'm talking of inferior oblique. It takes a turn here, na, and goes here. This is the insertion into the sclera of the eyeball. Okay. Insertion. But actually it is acting from here only. Okay. So when it's acting from here, for the eyeball it is oriented superiorly. So it can elevate like this. It will help the superior rectus in causing, elevation of the eyeball. So it is acting from not exactly in the midline like the superior rectus, it's slightly towards the lateral side, away from the nose. Means nose is in the midline, so away from the nose, lateral side. So it will help the, which rectus? It will help the lateral rectus muscle, so that it can cause abduction. Hopefully you understood these actions of superior oblique and inferior oblique. In this topic I have told you about inferior oblique. There is a separate video for superior oblique. Okay, so the main action of inferior oblique is extortion, the movement of the eyeball upwards, backwards and laterally. Like if you just think a chameleon, na, if it wants to see an ant in this area, some insect in this area, it will turn its eyeball like that. Na? That is the action of inferior oblique. Main action or the prime action of inferior oblique is extortion of the eyeball. Additional action is, it helps superior rectus in causing elevation. It helps lateral rectus in causing abduction of the eyeball. Thank you for learning from Logic Medico. Thank you for learning the inferior oblique muscle. Kindly consider subscribing to our channel and kindly press the bell button. Share this video to maximum number of friends and family members. Thank you once again for watching and learning from Logic Medico.